The Cornell Medical College conducted a study in Haiti about the spread of HIV through sexual partners. During this study, the non-infected partners were not informed that they had a chance of contracting the virus from their HIV-positive sexual partners. The HIV-positive partners were told that they would receive treatment for HIV. However, not all positive patients received this treatment, and those that didn't necessarily receive the best possible treatment for the virus, as they were led to believe they would. The Cornell AIDS study is unethical. The principle of beneficence states that physicians have a duty to do what is best for their patients. The Cornell AIDS study does not allow for what is best for their patients. The HIV-positive patients are not receiving the best possible treatment for HIV, as the principle of beneficence would state they should, and the researchers did not inform the HIV-negative partners about the risks of having an HIV-positive sexual partner. Therefore, the Cornell study goes against the principle of beneficence. The principle of non-maleficence states that physicians have a duty to cause no harm to their patients. Not informing the HIV-negative partners in this study causes harm to them, because they have a risk of contracting HIV from their partners and don't understand these risks. Thus, the Cornell study goes against the principle of non-maleficence. According to Tomasma, truth-telling is a right, a utility, and a kindness. Truth-telling requires the physician to disclose all relevant information to the patient. The physicians and researchers did not disclose all relevant information to the patient, such as not informing the HIV-negative partners about the risks. Not informing the HIV-negative partners undermines their autonomy, and in order to be fully autonomous, a patient must be fully informed. Therefore, because adequate disclosure was not given, and therefore the patients were not fully informed and were not fully autonomous, the Cornell study goes against both the principles of autonomy and truth-telling. Utilitarianism is a moral theory that states that the choice that maximizes the amount of good for the most amount of people and minimizes the amount of bad for the fewest people is the ethical choice. Some could argue that this study is for the greater good because the research and the knowledge found could benefit countless people if we were to find a vaccine or a cure for HIV and AIDS through this study. However, the study causes great harm to its subjects. They receive little to no benefits from the study, such as inadequate treatment, and the HIV-negative partners are harmed due to the fact that they are not fully informed. Although the study will benefit numerous people, the benefits don't outweigh the harm done to the subjects. Kantian ethics states that people should be treated as an ends in themselves. In the AIDS study, the patients are treated only as a means to an end. The patients are essentially being exploited in this experiment. There's a lack of informed consent, and therefore a lack of autonomy. And therefore, the study goes against the principle of Kantian ethics. Because this study goes against the principles of beneficence, non-maleficence, autonomy, truth-telling, Kantian ethics, and utilitarianism, as we have argued, the Cornell AIDS study is unethical.